Hi, it's Jessica Cooks here, and this is my final soap note for FMP 597 and my final soap note for my FMP program at United States University. So thank you for watching. Today I am presenting MN, who is a 43-year-old African-American female. She drove to the clinic alone, and she is a reliable historian. She came in with a chief complaint of, I cannot sleep at night, and it is starting to make me feel extra tired at work. So the main concern we have here is her inability to sleep and the difficulty staying awake at work, which is obviously affecting her performance. So she was recently promoted to a management position at her warehouse job, which requires less physical activity and often leads to eating more processed food and more restaurant food. So when speaking with MN, she said this is the reason that she started taking hydroxycut, and this is a weight loss medication which does have caffeine in it. But she also says that she used this medication about 10 years ago in the past, and she did not have these problems with sleep. So, of course, she doesn't believe this is the cause of her inability to sleep at night. Other than the hydroxycut, there are not any new medications, routines, or apparent triggers for the sleep disturbance. And MN explains that she lost a close family member, a niece, actually 3 months ago, but she believes she is coping well with the loss. She has a good support system. She's been able to grieve. Her family, her work family, and her friends have been very supportive. And we went on to discuss some things that she has done to try to help her sleep. So she does drink coffee maybe 2 to 3 times a day to try to stay awake at work, but she has been drinking coffee for many years. But she cuts off coffee after 5. She also does not eat or drink anything 2 hours before her bedtime. She goes to bed, she says, around like 10 p.m. And then she turns all the lights off, keeps it nice and quiet. And she still is very restless. Like she said, it takes a few hours for her to fall asleep. And then she only sleeps for maybe 4 hours and sometimes less. So she said in the past, maybe 3 years ago, she took melatonin, and she stopped taking that medication because it didn't help. And she said about a month ago, she took Benadryl, and it did help her sleep. So she took it a couple of times, but she just said she felt too groggy when she got up in the morning for work. So she stopped taking that medication and currently isn't taking anything outside of the hydroxycut. So, the last time a man has seen a primary provider was for a routine physical 2 years ago. And she said her physical and her labs was unremarkable. And today, during her assessment, her vital signs are within normal limits, but her BMI is 25.1, which is actually only 0.1 enough to be considered overweight. So other than that, she doesn't have any past medical history, no past hospitalizations. And her review of systems just revealed the increased sleepiness, daytime sleepiness, and a little stress related to work because the effects that sleepiness have on her performance at work. Her physical exam is unremarkable. And so we move on to our assessment. We're definitely going to consider grief for this patient because even though she has a good support system, this lack of being able to sleep could be due to grief. But that will not be our primary diagnosis for this patient because, again, she does have a good support system. She's able to discuss it without any changes in her mood, and this is something she personally feels she's coping with. So we'll move on to a diagnosis of anxiety. Perhaps there is some anxiety related to this new role at work, this new position. But even with anxiety that she could be experiencing related to this role, it's not likely that she would have the sleepiness. It would change her sleep pattern. So it doesn't explain the inability to sleep at night, which is continued for it's been over 3 months, and it wouldn't explain the sleepiness at work. So we are going to go with insomnia due to the sleep pattern, and then the use of caffeine, which may be a trigger for the insomnia, even though she's used the medication which contains caffeine in the past. That, in addition to her drinking the coffee, could definitely cause this insomnia that the patient has experienced. So the collection of the history with the patient's self-reported symptoms, it definitely indicates insomnia. So we can check her labs, like just run a CBC with differential electrolytes, thyroid panel. We can even do a urine drug screen and then a glucose tolerance test. We just want to rule out any possible causes of the insomnia. And that would be our first course of treatment for this patient to treat the cause, of the insomnia. And that would require us to get the lab results back and see what's going on. So the first thing we do want to do after we get our labs done is instruct this patient, discontinue that hydroxycut. Since her plan is to lose weight because of the fears of being less active at work, we're going to increase physical activity with this patient. I'm going to instruct her, she can walk at work, create a walking routine. If she doesn't have to stay at her desk the whole time, just set a routine and walk more at work, and then try to increase her physical activity outside of work. And she seems to have a pretty good diet. We talked about her. She takes a good amount of vegetables in daily, and she doesn't consume any red meat. She eats basically fish and chicken, no pork, low salt. She says she does low fat and like low sugar, try to stay away from processed food and carbonated beverages. We want her to continue those things, but then we just want to kind of see if we can set a meal plan. Maybe she can decrease her carbohydrate intake. Maybe she can reduce the kind of things that she eats late at night. We can go over just meal preparation and planning to see if we can help her lose weight, and perhaps refer her to a nutritionist that can kind of give her some better food choices to work on. And we do want her, since we don't want this patient, the insomnia is already affecting her day-to-day life, we can try Ambien 5 milligrams by mouth once, at hour sleep. We can try that one for 4 weeks to help with her sleep, and then we would encourage her to continue her sleep routine, not eating or drinking late at night and keeping it dark, cutting down the noise. And we definitely want to see if we can create a plan to reduce her caffeine intake. And we will have this particular patient follow up in 1 week just to check the status to see if she's sleeping. And then she will follow up 2 weeks after that to see if the medication is working and see our plan. And after that, she can just follow up in a month and we can continue. If you have any suggestions, I'll take them. But thank you for watching. Have a good day.